is the Investor Connect podcast program. This is Hall T. Martin. I'm the host of the show, in which we interview angel investors, venture capital, private equity, family offices, and many other investor groups for startups and growth companies. I hope you enjoyed this episode. Thank you for joining us. Well, hello, this is Hall Martin with Investor Connect. Today we're talking with Dan Wasserman, an entrepreneur and health technology commercialization specialist and the founder of Mammoth Health Innovation. Dan's work sits at the intersection of biomedical research, business strategy, health innovation, and market development. With a background that includes a BS and MBA, he has focused much of his career on helping scientific and medical technologies become real, commercially viable solutions. Dan, thank you for joining us.
Thank you for inviting me.
Great. Well, let's start with the founding story behind Mammoth Health. And what was the problem that it was created to solve?
It was initially created as an outgrowth from an innovation center here in Canada. And I have 40 plus years on the innovation side, both sides of the border. And when I came back to Canada after 11 years in DC, and I had 3 years prior to that in Hollywood, my focus became I was voluntold, you're handling the health portfolio. And again, because of my specific background. So I was given a number of clients and told, make something out of it. And long story short, I created something called the health ecosphere. And that pulled together all aspects of what has to go together to commercialize a health innovation. And nobody had really done it from that perspective before. And I did that for a number of years, and it sort of hit a wall at the 6-year mark. And I could see it couldn't go very much further. So I came up with a concept of, because of the Hollywood years, what about diving into the deep pockets of the Canadian expats in the entertainment industry and have them fund health innovation that comes out of Canada? And it took me a few years to put something together. I was working with a really great team down in Hollywood. I did a launch at Canada House, which is the Consul General's official residence in Los Angeles, and had about 50 people in the room, and everything was humming along, except for one thing that happened. I had my final meeting in November of 2019, and supposed to go back in March, and guess what happened? COVID. All the money left the table. And as your investor group would appreciate, that really was the kiss of death. So from that, I said, okay, I've got to really drive Mammoth, because Mammoth was at outgrowth. That was the official launch of the company. And came up with, again, on the innovation side, how do we drive innovation, either side of the border? And the funny thing was, I was starting to pick up some American clientele, which gave me some further insight into thinking south of the border. But I also knew, being a Canadian, there had to be a way to move things forward up here. And I pulled together a team of really, really great people, the head of a number of the official organizations in the health innovation space. And we came up with an acronym and a tool called ACIP, Advancing Canadian Innovation Through Procurement. Unlike the American innovation system, which procurement is a large part, and there's the SBA, and again, I was privileged to be mentored by the late Dr. D. Bruce Merrifield, who was the Undersecretary of Commerce, the Assistant Secretary of Commerce for Small Business under Ronald Reagan. So I really was, and he was the man behind the legislation for the SBIR. So I was really well versed in what the American systems were. The long and short of that is I said, okay, there's things we could do up here, starting with procurement. And our team put together some excellent verbiage we submitted to the Canadian federal government. It wound up in the 2023 budget. And it's taken till now that it's starting to get traction. But it was, again, the realization there are things that can be done and should be done, but we've got to approach them correctly. And that was really the genesis of Mammoth to where it is today. I probably went a little long on that, but I think it's an interesting story, and you got to keep pushing ahead. You've got to stay focused. You've got to stay enthusiastic, and you've got to build.
Well, it sounds like the persistence paid off and came with a great reward there. So let's talk about the biggest challenges facing today's healthcare systems. What are they, and where does innovation come in to have the greatest impact?
I've got gray hair. You're not there yet, but that's our single biggest issue everywhere worldwide. Aging population, shrinking budgets, higher costs, new innovation that's needed to offset that really huge gap between the aging populations and the need for healthcare. It's a U that you're dealing with. At the one end of the U, you've got newborns and neonatal. At the other end, and it's expensive, but then you get through the rest of our lives, and then you come to the later end, and it's the seniors. And we're a disproportionate part of the healthcare system, both sides of the border, actually globally. And how you can bridge that gap is through innovation. But you've got to understand that innovation doesn't necessarily translate into commercial success. If you don't have a commercial orientation to begin with, it's very, very difficult, if not impossible, to have some fantastic innovations just die on the shelf.
Well, great. Well, you've been spending your career building technology that improves healthcare. How do you do so that it actually delivers what it's supposed to do and provides efficiency and the patient outcomes we all want?
That is a fantastic question because that's what gave rise to Chiefs, which is the KPI engine, if you will, for how to evaluate a health innovation from two different perspectives. First of all, Chiefs started off as Canadian Health Innovation Evaluation for Success. That was the acronym. But on picking up more cross-border and international business, it's morphed and it became the obvious ones that make sense, which is customers, health, health economics, impact, execution, finances, and success or scaling. And building on that, considering the model is 50 proprietary criteria distilled down to 10 factors, and then those are compressed into the 6 pillars that I just mentioned, the CHIEFS, gives on one hand the innovator the insight as to what in what they have developed needs attention. Have they really properly developed the intellectual property? Have they properly focused on corporate development? The 2 R's, regulatory and reimbursement. All the key elements come together to tell them, hey, wake up. This is what you've got to do to make this a viable, potential, commercializable company. The flip side of that, or let's say the corollary to that, is from the investor's point of view. And that's where the pillars come in. On my website, which is www.mammothhealth.org, you can see 2 examples. One is of the findings, which is what I just mentioned with regards to the innovators, and the other is the pillars report. The sample that's up there shows that the findings, they made the threshold, which is they scored 25 overall. But the pillar report shows that they really are not ready for investment. They have a major failure buried in their numbers, and they only came out at a 4.9 and they needed a 5. Now that sounds like they made it, but when you dig a little deeper and you see that they didn't do a proper examination of what the total addressable market is, means that they started to fail on the customer side of the equation. That can be the kiss of death. So understanding the elements that have to come together is why this could very well become I hope, the de facto key productivity indicator or KPI when you're looking at health innovation.
Great. So tell us more about the lessons you learned as a healthcare entrepreneur navigating a regulated industry. What did you take from your experience with that?
It's not for the faint of heart. You're an 11-year overnight success if you're lucky. The numbers are fantastic for the winners, but you've got to have perseverance. And that's both sides of the equation, the innovator side and the investor side. You've got to have the wherewithal and the understanding. This is not basic IT. It's not going to turn over overnight. You're not going to have a huge success in, I don't know, months. You've got to be willing to go through what has to be done. And that includes regulatory. And one of the big problems is, getting back to your prior question, is people concentrate on regulatory and they go through the FDA and they go through Health Canada, go through the European, they go through the Japanese, they go through the Chinese. But what about reimbursement? Who's going to pay for this? So those are the lessons that I have learned and impart on the clientele I deal with to make sure that they consider all aspects of the undertaking.
Hey, well, what are the challenges with product development and customer validation in healthcare markets where you don't necessarily have because of regulatory, you don't have customers that can just try out the product. You have to use proxies for it. And how do you solve that problem?
Well, first of all, and this is where I really learned a lot, because it's a two-way street when you become an adjunct professor like I am at the Icon School of Medicine in their biomedical, their graduate biomedical and innovation program. And that is that you have to be prepared to really get out and find out who is the customer, because you have the different aspects. Obviously, in some cases, it is the payer. Sometimes it can be the practitioner. It is never the patient. But we're the ones that need the net benefit to have a proper outcome. And if you don't get out and find out from the different aspects of the customer groups, you are not going to succeed. At the end of every lesson, whoever was leading the lecture would say, "Get out of the building." And that really is key. You've got to get out and find out who your customers are, talk to your customers, bring that information back, work with your team, and then work it into your undertaking.
Great. So how do you build partnerships with providers, payers, and the general healthcare organizations? What makes those things successful?
Okay, from my perspective, and I'm talking very personally here, and this actually harks back to my years in DC, forming strategic partnerships, getting out there again, but talking from a slightly different point of view, which is that go to the conferences, go to the events, get on the panels, et cetera, and find out, what are they really looking for? What is the problem they're trying to solve? What is the hole in their deliverables? And what do you have that can fill it? And learn how to go out and introduce yourself and listen more than talk, and then come back again with your team, come up with a strategy, then go back to the potential strategic partner. There is one advantage in the United States that American innovators know well, which is through the SBIR program, and the fact that a percentage of the money that you're awarded has to go towards commercialization. That doesn't exist in Canada. I wish it did, but it doesn't. Right there, it opens up the opportunity to get out, go to the conferences, and do the things I just said, meet and greet and all the rest, and find out what you need. Because again, you've got the money to do that. In Canada, it's a little more challenging, but again, get out, talk to the right people, and form strategic partnerships. One thing that bugs me no end is when I sit in on an angel presentation of a health innovation, and they say, "I've spoken to J&J, I've spoken to Abbott, I've spoken," pick the name of the big pharma company, and it's a matter of, okay, at what level did you speak? What information did you bring back? Have you really done your research? Or did you just go on, to Dr. Google, look to see who the contact was, call them, talk to their admin, and then say that you've spoken to them? That's not going to cut it.
Right. I actually did that once. I asked them, "Oh, you talked to J&J. Who did you talk to?" They talked to the lab techs, and the lab techs really liked it, which at some levels a vote of validation, but for an M&A exit probably was not sufficient in that case. So good point there.
Well, without
Um,
asking a question, you've just brought up the real kicker, which is at the last part of the 10 functions, which is exits. And in health tech, if you don't realize your starting point is your exit, you've missed a big chunk of the undertaking.
Absolutely. Absolutely. You got to understand how you're going to get out before you get in. If you,
Well, why are your investors going to invest unless they're, friends, family, and fools? The rest of they're there for an exit.
Absolutely. That's one of the first questions the investors ask is how am I going to get my money back? And I think partly that's just a test to see if you have even thought it through and have a reasonable explanation. We always get the three comps up there that are usually three outlier examples, but we're all going to be above average like Lake Wobegon. So we're going to get that too. So it's
Yes.
a very positive view of the world, which is in one sense nice, but in another sense hard to invest in for sure. But let's talk about AI. AI is coming up, and some people have great expectations, and other people have great fears about it. What do you think the role of AI, automation, and data is in the future of healthcare? Where's that going to land?
Okay, which level are we going to talk? And that's me being rhetorical. AI at the lowest end is going to help you with your charting, with your note taking, with your referrals. That's the low end of it. And there's systems out there that do a number of those things right now, and some of them are really, really cool. And I've seen some in Canada, and I've seen some in the States, and I've seen some in Europe. They really are, and they take a load off the practitioners because when you hear that 40% of their time is going into charting and doing non-patient hands-on work, you've got to address that because the throughput could be so much better and so much cleaner and so much faster if it's properly addressed. So that's one level of AI. The next level is how do you plan your medical research? There's AI tools there out there now that are identifying the next drugs, the next pharmaceuticals, and even some different other kinds of developments that really are needed. So that's the next level, the forecasting side of the equation and the ability to pull things together. The next level is integration. And that's where what along the lines of what you and I were discussing before we started our conversation, which is I've got a lot of information of my own that I've collected over the years. How do I use that going forward? Not necessarily on a commercial basis, but on a straight research basis. You've got your own, it's not a large language LLM, it's a small one, but it's targeted. So how can you use that? Does it affect my practice? Does it affect my patients? And does it affect my hospital? Those are the kinds of things that you would have accumulated on your own. How do you get it into artificial intelligence? That's another question. But if you can pull those three strata together, boy, AI is powerful.
I agree. It's going to be a great boon to the industry, and hopefully it'll reduce some of the costs that we're seeing there as well. But let's talk about going worldwide with it. How do you scale a Canadian technology company for the international markets? What do you have to think about there?
Okay. And what I like about that question is it's only a handful of months ago, I guess that question would never really even come up because with our prime minister saying that we're going to look, how do we do things that go not just to the United States, but to other countries? And the honest answer is you've got to do the same things. There's no difference. I had a call earlier today with one of my contacts in Bucharest, and she was telling me about different things that she's been involved with and some clients of hers. And I gave her some advice and things like that because we've got a really good collaborative relationship. And the point is that you've got to go through all the same steps. Now, some countries do have commercialization opportunities along the lines of the United States, others don't. Those that don't, you need the same tools to commercialize what's developed there. If you're taking a Canadian technology to Europe, you've got to get the same, you've got the European regulatory bodies to deal with. You've got the European government bodies that manage the reimbursement side, but most of those countries, unlike Canada, and that's where there is a difference. Canada is totally public medicine. In these other countries, they are dual. You have public and private. So again, you can build a business going after the private segment in the EU. Is it the optimal way? Not necessarily. You should still be looking at the European medical regulatory and European, well, you have to look at the regulatory, but look at the European by the individual countries. But in the United States, it's a totally private system, so it's straight up.
Right. So, based on your fundraising experience, what's your advice for health tech founders seeking investment? What do you coach them to do before they go out to raise that round?
Go through chiefs. Have the key indicators ready for the investors. Have the show where you were deficient and how you've addressed it. Be professional. But then again, I'm sounding self-serving. I don't mean to be. The point is that if you've ticked the boxes and you know the boxes that you've ticked, the ones that still need to be addressed, take care of them and then make sure you're also talking to the right people. Let's come back one half a step. How do you go out for investment at any early stage company? Find out who invests in your sector. If you don't do that first, how are you going to make sure what you're going to say is going to fall on ears that understand what you're talking about? Goes back to my advertising experience. Know your audience.
That's a good one. So let's talk about the long-term vision for Mammoth Healthcare. How will it evolve over the next years with the healthcare market?
It's actually going in a couple of directions, and I'm at this point open enough that I want to let it happen. I have had, as I've sort of alluded to, a couple of excellent conversations with senior government officials here in Canada over the past couple of weeks. And there is a need, there's a screaming need for the way to advance and identify the health innovations that really should be commercialized. And there's a lot of interest now in Chiefs, in Mammoth, and with our Chiefs product. I'm talking at the federal level. I've had an interest at the provincial level for some time, but now we're breaking through at the federal level. So that's happening. I also have conversations that are going on in the United States that I think are going to bear fruit on a broader basis. There's a fund that I'm affiliated with that we want to see get funded, and where Mammoth and specifically Chiefs is the gating mechanism. You've got to have gone through Chiefs so that the investors know that there's something solid there to deal with. And then on top of that, as I've already mentioned, I have contacts in a number of countries around the world. And again, they've reached out to me from Israel and the Middle East, from Europe, both traditional Europe and Eastern Europe, from Northern Europe, UK, and a couple of inquiries now that have come from the Far East. So those are the ones that I think are going to be leading Mammoth forward. The main thing is, though, that as far as a product goes, Chiefs, it does check a lot of the boxes. So,
Well, great. Well, this has been a great interview in the last few minutes that we have here today. What else should we cover that we haven't?
I think the main thing is that recognition that, which we sort of touched on, that with the aging population, with less funds everywhere, we have to be smarter. We are living longer, but we want quality of life too. And to have that, that's where innovation comes in. We want to be healthy, not just old. We want to be active, not sedentary. And those are the things where I think having the right tools and having the right ability to have the clear outcomes makes total sense. From my bottom line, I go back to something I said earlier. You can have fantastic tech, but you've got to be able to commercialize it to have a success. And the success means that we have better outcomes as human beings.
Great. So how best for listeners to get back in touch with you?
The easiest way is through my website, as I mentioned before, www.mammothhealth.org. You can email me, dan@mammothhealth.ca. And those are the best ways to get hold of me.
Great. We'll include all your contact details in the show notes. I want to thank you for joining us today, and we hope to have you back for a follow-up soon.
Well, thank you very much. I really appreciate it.
Investor Connect helps investors interested in startup funding. In this podcast series, experienced investors share their experience and advice. You can learn more at investorconnect.org. Paul T. Martin is the director of Investor Connect, which is a 501c3 nonprofit dedicated to the education of investors for early-stage funding. All opinions expressed by Hall and podcast guests are solely their own opinions and do not reflect the opinion of Investor Connect. This podcast is for informational purposes only and should not be relied upon as a basis for investment decisions.